What is up, YouTube? It is Coach Kolton here to bring you physique development tools, skills, and opinions that hopefully you can use for yourself to make some gains. Today, in this video, we are once again surfing the Reddit forums, ending up on more plates, more dates, of course, talking about an individual who is 20 years old asking if he is balding from Tren and test. This is ridiculous. I have to say for myself, like, I can't believe I'm reading this, but I wanted to share it with you guys as sort of an educational piece to maybe get a grasp of what you could be doing to yourself in the future from using certain compounds at such a young age. So let's get into it. This individual, without a description, just kind of asked the generic question, am I balding from Tren and test? You look at him, first of all, I noticed right off the bat, he's developing gyno. His nipples are highly inflamed, and it's pretty freaking obvious right away from this first picture. Second thing is he has like an above average physique for using Tren and test already at 20 years of age. Certainly developing some sort of baldness around the crown. This could be completely genetic and likely a result of his just life, like what's going to happen to him as he ages. He's going to experience androgenic alopecia, which is common, especially amongst the Asian community. You get that kind of crowning effect. You see that a lot. So this isn't sort of unusual. I'll go ahead and read some of the comments. Maybe you should be definitely concerned about losing hair is what he's saying, but definitely have some nice tits. Totally. Fuck your hair. Within 6 months, you'll lose it all along with your anal virginity. If you by some chance have it still intact and you continue to blast ridiculous trenbolone. I'm not hating, but it amazes me that people can see deaths at 25 to 35 and still go, yep, I'm going to fucking take Tren. 400 milligrams of Tren at 20 years old. Seriously, you couldn't wait? Question mark. Not hating, but what made you decide to use Tren on your first cycle? So you can see like people in the comments are just inundating him with a bunch of hate, literally, which completely, you're posting on a Reddit thread that's generically educated. I'd still say like majority of the people on this thread or subreddit are, of course, like undereducated, but they have a general gist of what's probably a good idea, what's probably a bad idea. Someone took a screenshot of what he replied. He actually deleted this comment, so it's no longer on the thread, but I'm going to read it. He says, this is the op. He says, hey guys, I'm 20 years old. I hopped on Tren at 400 milligrams and test E at 300 milligrams weekly around December. I was natty before that. He was natty before taking 300 milligrams of testosterone and 400 milligrams of trenbolone. Okay, so that's nearly a 700 milligram. It is a 700 milligram total combined dosage, but also that's a massive dose of Tren. I've never even had a competitor get above 150 milligrams. And some people are going to say bullshit on that. That is completely true of Tren. Like there's no use in getting that high in Tren. Some people might say there is. I haven't found one yet. I was natty before that, so basically it's been 2 months into my cycle. At the gym today, one of my friends noticed my crown area is losing or balding when I was crouching down to get a plate off the ground. Every part of my hair is growing, no thinning or shedding, except that part in the picture, which is just that crown. I'm going to purchase minoxidil and Malil rosemary mint tomorrow to treat the area of my hair from Walmart. My mom and dad doesn't have bald genetics. Please let me know. Thank you. Okay, so this individual, kind of right off the bat, I get the idea that maybe he's not the most educated individual. And 400 milligrams, like somebody must have just told him to, hey, dude, do this. People are just lying to you. It's going to be fine. That's terrible, right? Because you're initiating the effects of dying early, like honestly. And it's just the toxic sort of oblivious state that bodybuilders live in, including myself. We tell ourselves everything's going to be fine, and that mentality kind of spreads throughout. So it's just a really bad situation. I don't recommend ever doing Tren or test at this dose for your first cycle. I don't think, like I mentioned in previous videos, that it's going to be worth your time or worth those health detriments. But to each their own, and obviously this man will find his way, hopefully, but we can hope. But I do want to show you guys a study that recently came out talking about inflammation and hair loss, and I thought it was interesting to correlate with this. at first, is he balding from Tren and test? Do I really even have to ask that question? I think it's pretty obvious that, yeah, you're likely developing some of that crown balding because of certainly Tren and test. I appear to have like locks of hair, right? But I've certainly lost some hair since partaking down this path, and it's going to be different for everyone. Some people are going to lose a lot of hair. Some people are going to lose a little, and it just depends on your genetics in that situation. So there's a lot of great material here about alopecia, and specifically androgenic alopecia and its effects when concurrently experiencing high levels of oxidative stress and inflammation. I pulled up one study here in particular. I couldn't find the original one I had read. It was, I think, made by the same lab as these individuals. In the same journal, but I couldn't find it. So maybe this is one of its pre-copies. I'm not sure. But anyways, recent literature reports to have approved the presence of inflammation and also oxidative stress at high levels of dermal papilla cells of patients with androgenic alopecia. So really what we're looking at here is high levels of C-reactive protein, high levels of oxidative stress can cause a lot of issues when it comes to androgenic alopecia. And so what happens in general, in my thought, is when individuals are undergoing a large burden of copious compounds like trenbolone, it's going to really raise oxidative stress, really fluctuates oxygen metabolism. You're going to get a lot of that balding from more than just the DHT signaling. From more than that, you're going to get a lot of balding because you're creating so much oxidative stress, because you're creating so much inflammation. There's also many studies talking about the MET syndrome or metabolic disease and androgenic alopecia, or just alopecia in general. This is worth bringing up because this individual, once again, if we're looking back at his pictures, does not, quite frankly, look to be in any sort of condition that's, healthy. I wouldn't say, depending on this individual's lifestyle, he might very well have some of the metabolic syndrome risk factors, a higher waist circumference, which I'm not so sure if we can see here accurately, high cholesterol, high blood pressure, high blood glucose, who knows? There could be a lot of issues underlying that we can't see from this picture. And so that could also be a driving factor to his alopecia. So oxidative stress, alopecia in general, paired with metabolic syndrome. And there's also studies showing like mortality rates in individuals experiencing alopecia are higher, and that alopecia might be a valid way of determining an individual's health in a way, sort of like a health marker, without having to be invasive at all. So it's worth noting, you guys, this is a 20-year-old on trenbolone. Don't do trenbolone. If you're not getting on stage in 8 weeks, there's really no point. Just toss that shit out of your drawer. Use something, if you're going to use something either bioidentical or something that has a very, very safe drug profile, such as like a primobolan or even a Masteron, but try to stay away just from the rest of the shit. There's a lot of neurological effects to be talked about that aren't in this specific post, but you're going to experience a lot of unhealthy and just not wanted side effects from using compounds like this. They're glorified on the internet, and it really fucking sucks because a lot of young kids like this get into a fucking shitty situation. And if I was this dude, I would be literally dropping trenbolone right away, dropping down testosterone to 125 to 150 milligrams, cruising it out, letting the Tren get out of my system, depending on if it's trenanthate or acetate, and then just moving forward and restarting. Say goodbye to your hair because it's far too gone at where it's at already. And just hope for the best and cross your fingers. Go get health markers checked, blood work, cardiac scans, liver scans, kidney scans, cystatin C specifically. See how you're doing, and make sure everything's okay with that high of a body fat percentage and that being that young and using that much Tren already. So I hope that was useful. Take it as you will, I guess. This isn't a personal professional advice. This is just me saying this is a fucking idiot and me really reacting to this, and I can't believe someone has fallen into this trap again. So